Do you ever feel tight in your neck, achy between your shoulder blades, or notice that your head creeps forward throughout the day? You might be dealing with something called upper cross syndrome. The good news is it's completely fixable. Now, upper cross syndrome is a really common postural imbalance, especially with how much we sit, we text, we look at screens, computer screens, phones, all that good stuff. This typically happens when certain muscles become overly tight and other muscles become weak, and it starts to form like an X pattern across your upper body. The tight muscles are usually the upper traps up in the shoulders, your chest muscles, and then the weak muscles are usually in the neck and the mid back stabilizers like your rhomboids and the lower traps. Now, when this imbalance develops, the body falls into a forward head and a rounded shoulder posture. So, here are some of the most common signs I see in the clinic here. The patients typically have constant tightness in the neck or the shoulders. They have headaches at the base of the skull, pain between the shoulder blades, and reduced mobility when they're turning their neck or they're looking up. And even the worst cases, they have numbness and tingling down the arms and down into the hands. So this posture starts to compress the rib cage. This can influence how your lungs and your breathing pattern, all these kind of things. Most of these people just think they're stiff, but stiffness is often the way your body's telling you something's not working anymore. And now this is where chiropractic care comes in. We can make a huge difference. First, we restore the proper motion of the joints. Those are the ones that get locked up. They're usually in the neck or the upper back or upper thoracic spine. And then sometimes we can work on the ribs too. When those joints start to move better, the muscles finally get a chance to start to relax. These adjustments also reduce nerve irritation, which can improve strength and decreases that burning, achy, or the tingly feeling that most people get in their arms and their hands. Then with the adjustments, we also combine corrective exercises, kind of like some physical therapy. These help to retrain the weak muscles and then start to lengthen or stretch the tight ones. Now, this combination of mobility, the neurology, and the strengthening is what actually starts to correct these patterns for the long term. So if upper cross syndrome isn't addressed, it usually progresses into like this forward head posture. It increases the load on your neck and significantly, and over time, that can lead to early degeneration or some arthritis and wear and tear. This can lead to chronic headaches, disc issues, pinched nerves, and even decreased lung capacity. The good news is your body is incredibly adaptable. When we restore the alignment and teach your muscles how to support you properly again, you'll start to feel lighter, you'll move better, your energy will start to go up. Lots of different changes there. So if any of this sounds familiar, this tightness, these headaches, the rounded shoulders, poor posture, don't just ignore it. Upper cross syndrome is extremely common in our culture today, but it's also extremely correctable with the right care. If you're ready to get checked out, want some chiropractic care, interested in what we do, our scheduling links in the bio, or you can send me a direct message and I'll get back to you. I'll gladly help take a look at your posture, your spine, and get you on a plan to correct it so that you can feel and move your best.